Hello, everyone, and welcome to week 9. I'm Dr. Pauline Stoltzner, and this week we will be focusing on trauma-informed care. Trauma isn't rare, it's common, and it doesn't always look like we expect. Trauma-informed care, TIC, means we approach every patient interaction with the assumption that trauma may be present. Our goal isn't to diagnose trauma. It's to avoid re-traumatizing and to create safety in every encounter. So what do we actually mean by trauma? Trauma can be individual, like abuse, neglect, or violence. It can also be historical or structural, like colonization, racism, or poverty passed through generations. All of these forms of trauma affect health, behavior, and trust in the system. Think about a patient who has been hard to engage. Could trauma have been part of the story? There are 5 core principles in trauma-informed care: safety, physical and emotional, trust and transparency, collaboration and peer support, empowerment and choice, cultural, historical, and gender awareness. These aren't just buzzwords. They shape everything from how we enter a room to how we explain a procedure. So why does this matter so much in nursing? Patients with trauma histories may not disclose it, but you'll see it in their body language or mistrust. Trauma shows up in mental health, substance use, chronic disease, even pain perception. Our routine care, like touching, restraints, or rushed procedures, can feel unsafe to patients with trauma. Have you ever unintentionally triggered a patient's distress, even with the best intentions? Explain what you're doing before you do it, even with simple tasks. Ask permission. Is it okay if I lift your gown to check your incision? Let patients make choices when possible. Offer grounding techniques when anxiety is high. Beyond individual actions, we need trauma-informed environments. TIC starts at the front desk, not just in the exam room. Make waiting rooms and areas calming, provide privacy, train all staff, not just nurses or therapists. Reduce coercive practices. Even the tone of your voice can shift someone's nervous system. What parts of your clinic or unit feel safe? What parts might be scary or triggering to patients? Trauma-informed care is deeply aligned with our code of ethics: dignity, respect, non-maleficence. It's about power, recognizing that healthcare can be disempowering and working to reverse that, especially when caring for historically marginalized patients. TIC is not optional, it's ethical. Let's apply this to a case where you might need to think quickly and compassionately. A patient flinches and pulls away when you touch their arm to take a BP. Your impulse might be to feel offended or frustrated. But what if it's trauma? How can you reframe, slow down, and restore that patient's sense of control? How would you respond in that moment to prioritize trust and safety? What does trauma-informed care mean to you in your own nursing practice? Where do you see trauma being missed in your workplace? How can you commit to showing up with compassion, even in the busiest, hardest moments? Trauma-informed care isn't a protocol. It's a posture, one that says, you're safe here, you matter, I see you,